So welcome Dr. Pritpal to this session. Myself, Dr. Jasmeet, a member and a certified metabolic health coach from DLife.in. DLife.in, which is the India's first and only award-winning low-carb platform. DLife was founded in 2014 by Anup Singh. Anup is a silver medalist from IIT Roorkee and is a recipient of the Icons of India Award. Anup is a pioneer of the low-carb movement in India with his path-breaking protocol of 100-gram carbs per day max that made LCHF possible even for the Indian vegetarians. In 2021, DLife launched its diploma course, which is the only course approved under the NSTC partner, the Government of India in this segment, and the only course with the global biggest 144 hours CPD credit. So now coming to this session, in this session of the Metabolic Health Conference, we will be discussing the relationship between the autism, metabolic health, emphasizing the impact of nutrition and metabolic conditions on the neurodevelopmental disorders. So for this session, we have with us Dr. Pritpal Singh, who will highlight the importance of dietary interventions as potential therapeutic options for improving the symptoms in autistic kids or kids having autism. Dr. Pritpal, he is a renowned functional nutritionist, autism specialist, and researcher with over 21 years of experience. His expertise lies in the functional medicine, gut healing, and alternative therapies for the neurodevelopmental disorders. He has pioneered research on heavy metal toxicity in Punjab's children, and he also introduced camel milk therapy for autism, and he gained the international recognition for this. Dr. Singh has presented his work at the prestigious conferences, including the Northwest University, South Africa, and the FAO ICR NSCC Summit in India. He now continues to train professionals, conduct research, and he provides the global consultations as well, which is impacting the life of the children and the families worldwide. So welcome Dr. Pritpal to this session of the Metabolic Health Conference. Dr. Pritpal, you are on mute. Could you please unmute yourself? Okay, so my first question to you, it is of two parts. So is autism a disorder that requires treatment, or is a disability that calls for accommodation, or it's simply a different way of being in the world? So the second part is, what are the characteristic features of autism spectrum disorder? And could you also talk about the broad range of traits that individuals with ASD may exhibit? I'm not able to hear you. There is some issue with your speakers.
No, sir. Can you remove your headphones? Hello. Sir, still you are not audible. Sir, can you rejoin this meeting?
Yeah, maybe you need to connect to the audio.
Yes, मुझे वो जो दूसरा म्यूट करना
Fine now.
Yeah. Can you audible?
Yeah. So,
Yeah.
shall I repeat my question, or is
No.
okay? You continue with that. Yeah.
Just there is two school of thought about autism. One is autism in autism. It's traditional thought that autism in autism it's a neurobehavioral and developmental disorder. So it cannot be recovered at most. You can train the child, right? Nothing can be done because it's a psychological or a mental disorder. Somewhat they say it's a genetic disorder. And there is second school of thought. They say is autism is not only mental disorder or purely behavioral disorder. It's a whole body disorder, right? It's not related with only the only nervous system disorder. It's a you can say it's a whole body multi-systemic disorders. It's a both with multi holes, right? So इसके अंदर जैसे जनरली ऑटिज्म के अंदर जनरली ये हमारे स्कूल ऑफ थॉट है कि इसके अंदर आप ज्यादा इसको ट्रेन नहीं कर सकते, इसको ट्रीट नहीं कर सकते, नथिंग कैन बी डन। बट रिसेंट जो स्टडीज, इंटरनेशनल स्टडीज हुई, उसके अंदर ये क्लियर हुआ कि autism is a more than is genetic, it's a imbalance of biochemistry. Just like आप मेरे साथ बैठे हैं, बहुत सारे लोग बैठे हुए हैं, we are listening properly, we are understanding, and we are attending all these things, right? But on the spot, अगर हमें कोई अल्कोहल ऑफर करता है, right, within minutes our behavior can be changed.
Yeah.
Right? And our genes were same, or brain structure was same, everything was same, but what happened, what was new thing which were entered in our system, that was the alcohol that disrupted our biochemistry, and that's why हमारी जो behaviors था वो सारा alter होना शुरू हुआ। हमने ऑटिज्म के पेरेंट्स से अगर जनरली ऑटिज्म की फीचर्स से अगर हम देखते हैं, तो जनरल फीचर्स तो चलो मैक्सिमम लोगों को तो पता होगा कि अपने आप में खोए रहना, बैठे रहना, किसी से बात ना करना, बहुत सारे लोग बच्चों की स्पीच नहीं होती है, clappings, head bangings, laughing without reasons, crying without reason, and smelling the objects, and all these features are related with the autism. But जो हमारा ABA साइकोलॉजी वर्ल्ड था, जितने भी ये लोग थे, इन्होंने सिर्फ एक ही लिस्ट किया कि इट्स ऑल दीज थिंग्स आर द related with the behaviors. It's somewhat it's related with our limbic system, or it's a hardwired nerve system disorder. So that was.
So is it something
But
related with the Dr. Pritpal? Is it something related with the underactive of the sensory neurons of the kids? Like, they don't react. The gestures, they don't know the gestures because of the social interactions. They are like, they have anxiety interacting with the other people.
Yeah, definitely. And I want to complete it, right? जो अब 90% आप बच्चों को अगर आप देखते हैं, जो जेनेटिक थ्योरी को अगर आप वो कनेक्ट जो कर पा रहे हैं, 90% जो बच्चे हैं वो आफ्टर 3 रिग्रेस हुए, आफ्टर 2.5 रिग्रेस हुए। Before they was absolutely normal, right?
Okay.
So we don't totally ignore that it's ये genetic नहीं है, लेकिन we can say it's genetic predisposed children. So जब हमारा टॉक्सिक इन्वायरमेंट में, जैसे ये टॉक्सिक इन्वायरमेंट में आया, तो it was activated and
basically epigenetics plays a role here, no?
Yeah, it's epigenetic. It's epigenetic. And about the traits, about the counts of the ratio of the autism is increasing significantly. That also indicates it's not purely related with the genetics. See, I started my journey in 2003, and then at generally it was in every literature and books we were reading that it's a 1 in 300, but now it's a 1 in 25. Right? And if it's purely genetic, then genes take genetic mutations takes time.
Yes.
It takes generations, right? It cannot be changed within one generation. If it's true that it's a purely genetic mutation, genetic defects, then definitely we should set as alarming situation that it's epidemic. It's epidemic. We should declare it's epidemic, genetic epidemics, but it's not. It's related with the epigenetics, right? Secondly, the जितने भी autism के अंदर आप देखें, laughing without reason, crying without reason, smelling the objects, hitting the walls, head bangings, clappings, all these things, right? जो हमारे experience में, which I have experienced in my situation from last 20 years, by giving the just antifungal treatment only for 10 days, all these symptoms can go away permanently. राइट? और ये सिम्टम्स मैक्सिमम पेरेंट्स को बहुत ज्यादा इरिटेट करते हैं। एंड हमारे जो प्रोफेशनल्स हैं, ओटी स्पीच, ओटी एबीएस, ऑल दिस, दे आर स्ट्रगलिंग विद these issues up to years, right? But that can be managed within 10 days. It shows that it's a biochemistry, or biochemistry is influencing our brain chemistry. or neurotransmitters and everything, right? And एक और भी जो recent findings जो है कि autism जो है ये इस more than in boys के अंदर ये सबसे ज्यादा than in girls, right?
Okay.
If there is 5 boys who are suffering with autism, then there is 1 girl she is suffering with autism,
Okay.
right? According to years which we have coined all these things, and we are trying to correlate that. First thing is that in autism, microglial cells, they are more vulnerable to the toxicities, and testosterone, they are more sensitive to the thymus cells. All these things, all these are the factors that shows that why this is happening. But in female, there is a estrogen mechanisms. It's a strong mechanisms, and it's a neuroprotective mechanisms, and it protects that. It's a hypothesis that's why the females के अंदर ये autism की ratio कम होता है. And if it's a genetic, somewhat the recently जो mainstream doctors ये मान रहे हैं कि now जो आप रेशो आप बता रहे हैं कि इस 30-40 रेशो जो आ रही है, ये सिर्फ आपकी अवेयरनेस है. इस बहुत ज्यादा अवेयरनेस हो गई है, इसके कारण ये रेशो बढ़ गई. इट्स नॉट ट्रू, इट्स नॉट, इट्स ओके, इट्स वन फैक्टर, बट इट्स नॉट टोटल फैक्टर. इफ इट्स ट्रू दैट हम जैसे अब 1 in 30 है, मींस हमने अपने स्कूल पीरियड्स में जितने हमारे लोग होंगे, इन्होंने कभी इतने बच्चे नहीं देखे थे अपनी क्लास में, कहीं भी इतने बच्चे नहीं थे. एंड यू नो ट्रांसजेंडर जो है, थर्ड जेंडर्स जो लोग हैं, इनकी बहुत स्मॉल कम्युनिटी है, लेकिन फिर भी विजिबल है ना वो. लेकिन ये तो आपने कभी ऐसा नहीं देखा. अगर ऐसा था तो ये इनको पूरी सोसाइटी बन जानी चाहिए थी कि रोड्स पे बहुत सारे बड़े बड़े लोग, वो ऑटिस्टिक लोग होने थे, वो रोड्स पे फिरते जैसे अब हैं. अब पार्क्स में जाइए, कनाडा, ऑस्ट्रेलिया, अमेरिका, किसी पार्क में जाइए तो वहां पे पार्क्स भरे हुए हैं. लेकिन ये थे, फिर ये कहाँ गए? अडल्ट सूट्स में कहाँ गए? ये नहीं था. इट्स a recent epidemics.
Yes.
Even in the DSM-4, when we diagnose in the autism, there is mentioned all about the gut symptoms. They have a set of the questions about the gut leaky gut, antibiotics, and so many things, right? But not discussed, right? वो जब उसको आप क्वेश्चंस में, डायग्नोसिस में तो आप उसको ले रहे हैं, लेकिन उसके ऊपर कोई फोकस नहीं हो रहा. So we say it's more than a narcissistic disorder. It's a gut and psychology syndrome.
So definitely there is, Dr. Pritpal, there is no doubt that the gut microbiome plays a major role in both the mental illness and the metabolic health. But what are the factors you believe that contribute to this dysbiosis, and how do you people address this?
Yeah, definitely. अगर आप इन पेरेंट्स की अगर आप हिस्ट्री लेंगे तो surprised to know that first thing is the C-section, second is the breastfeeding, absences of the breastfeedings, overuse of the formulations, and overuse of antibiotics, overuse of paracetamols, overuse of carbs. All these are जो इनके पास्ट फीचर्स के अंदर आपको इनके अंदर हैबिट्स में, डायग्नोसिस में आपको फीचर्स में मिलेगा कि दे हैव पास्ड थ्रू these traumas or internal or external traumas, right?
Any specific nutrient you believe that the kids missed if they are not breastfed, and that increase the risk of autism?
Yeah, definitely. First is that if अगर हम बच्चे के अंदर सी सेक्शन से नेचुरली हमारा जो जब चाइल्ड बोर्न हो रहा है तो इट्स अ फर्टाइल, is purely sterilized, right? उसकी intestine, gut colony, that's totally sterilized. But how we first introduced by the first, if it's passed through vagina, then he inhales the gut flores, right? Vaginal flores. Second is that our first breastfeeding. We generally believe that जो हमारा vaginal flora है, इसमें 3000 types of species वो हमारे gut के अंदर जाते हैं, और हमारा जो ब्रेस्ट है, ब्रेस्ट फीडिंग है, उससे हमारा 1400 टाइप्स ऑफ जो स्पीसीज हैं वो हमारी कॉलोनी, गट कॉलोनी के अंदर जाते हैं, जो फाउंडेशंस ऑफ हेल्थ रखते हैं. लेकिन अगर ये दो फैक्टर्स अगर बच्चे के अंदर मिस है, तो डेफिनेटली गट dysbiosis वहां से शुरू हो जाएगा बच्चा, एंड चाइल्ड विल crave for the carbs only. And अगर breast feeding missing है तो definitely there was introduce the formula milk, and with the different flavors and different things, right? And more than with high sugar and artificial sugars. Even हमारे लिए ये होता है कि ठीक है, it's a recent अभी phenomenon ये चला है कि it's a fruit sugar, it's a fructose. But you know, fructose is dangerous than the simple normal sugars,
Yeah.
right? And एक molecule अगर sugar आप content लेते हैं तो आपको 26 molecules, magnesium and zinc and other digestive enzymes चाहिए. And but if you are taking the fructose, then you need 56 molecules of the magnesiums and zincs and all these things. And वहां से हमारी जो gut flora है जो dysbiosis शुरू हो जाता है. And then child उसकी बच्चे की history अगर आप देखते हैं तो he craves for always for the carbs, for the sweets, for the rice, for the wheat, for fast foods, for toffee, chocolates, and sweet drinks and everything. And after that, as he is consuming daily, and he is becoming picky eaters, वो डे बाय डे पिकी ईटर्स होता जाएगा. जैसे जैसे वो पिकी ईटर होता जाएगा वैसे वैसे उसके जो न्यूट्रिशनल डेफिशिएंसीज वो बढ़ जाएंगे. एंड जैसे हमने इन बच्चों को जो असेस किया है, इसका जेनेटिकली हमने इनका भी जो पाथवेज जो थे म्यूटेशन से हमने चेक किए हैं, उसमें मेजर जो आ रहे हैं जैसे DDR एंड MTHFR, राइट? दे आर, आप जैसे हम पहले विटामिन डी बोलते थे कि विटामिन डी आंखें बंद करके हर एक को दे देना चाहिए. अभी ये अंडरस्टैंडिंग कि आप MTHFR जो है मिथाइल टेट्राहाइड्रोफोलेट, ये हर एक बच्चे को दे ही देना चाहिए. Commonly, they are commonly deficit. And magnesium and zinc, as in minerals में अगर आप जाते हैं तो magnesium and zinc, right? We have tested more than 300 children with the international lab, Mosaic lab. Before it was Great Plains Laboratory in US, but now it's Mosaic, and we are getting service from them. And we tested more than 200 children. And ये major factors हैं. इसमें zinc है, vitamin D है, B12 है, B6 है, magnesium है, and folic acid है. ये सभी बच्चों में deficit है. And you know the cerebral folate deficiency, if there is cerebral folate deficiency, then that might cause for the epilepsy as well, right? And but now it's very common. And same we have also tested the mothers में जब उन्होंने टेस्टिंग किया तो same factors उसमें, right? They were also deficient with the MTHFR, वो एंजाइम उसमें नहीं था. तो ये common factor है. And secondly, जैसे से ग्लूटेन एंड केसिन की जो कंट्रोवर्सी है, उसमें बहुत सारे बच्चों में ग्लूटेन जो IgG एंड IG बहुत जो है और रिस्पॉन्स जो हाई है. एंड सेम इन मिल्क, you know, if gluten is not digested, if casein is not digested, then it will convert into the casomorphin and glidofins. It's just like a morphines, it's opioids. And as you will reduce these things, then they will see that the child start to eat everything, and from the picky eating and eye contact and speech and behaviors will be changed within few days, within 3 months even. अगर बच्चों को आप properly इसको अगर आप address करते हैं तो within 3 months ये उसको properly इनका जो condition चली जाती है. And जो generally हमारी मैं हर एक पेरेंट्स को यही बोलता हूँ कि he is not eating the sugar, he is not asking the potatoes, he is not asking the rice. It's bacteria, they are asking the potatoes and fast foods and everything. Basically it's a need, क्योंकि हमारे जो pathogens हैं, जितने bad bugs हैं, जितना उनकी basic जो diet है, that's they relies on the carbs-based diet
because they thrive on it.
As we replace them on high-fat diet, right? Recently, honestly, just been जब 2008 to 2013 तक हम grains based पे diet पे millets पे सबसे पहले millets हमने introduce किया इंडिया के अंदर. जब कोई 2009 के अंदर millets के ऊपर कोई बहुत ज्यादा बात नहीं कर रहा था, तो gluten free, casein free के अंदर हमने जो millets and camel milk, ये दोनों का एक अल्टरनेट ढूंढा कि
Why camel milk is so important?
Yeah, camel milk is a substitute of the cow milk. I'm not saying it's a Ramban remedy, right? I'll say it's a substitute of the cow milk, bovine milk, right?
Mhm.
Because of the casein and different types of caseins and lactoglobulins and high vitamin C and calcium. That's why it's a more reliable, right? And लेकिन रिजल्ट जो हमारा था 33 to 40%. Definitely वहाँ पे 60 to 70% were failure rates. Even we have started the chelation therapies, but it was not successful. Up to 2014 to 2018, we introduced the chelation therapy. Right?
Mhm.
It was so costly, very risky, but we have taken, we are continuing doing everything under the supervision of Dr. Amar Singh Ajad. He was a pediatrician, right? And but after all these things, our success rate was 60, 62. But in 2020, when we stopped the chelation therapy because it was very costly and we were being blamed that we were charging very high. Actually, we are not charging, but its cost was high because of importing the supplements and sending the test to the labs, and that was very costly. So we stopped, and then we shifted on the high fat diet,
Mhm.
right? Purely non. In our words, we say it's a non-veg diet, right? तो हमने प्योर नॉन वेज डाइट पे एनिमल डाइट पे जब उनको टोटली शिफ्ट किया इन बच्चों को, तो हमने देखा कि हमारी जो सक्सेस रेट जो है राइट नाउ इट्स गोस अप टू 80 to 90%.
What specific nutrient you believe, like, that people are lacking?
Yeah, definitely. In vegetarian pupils, generally in Europe के अंदर ये generally understanding है कि they are the all Asian people, they will have deficit in B12, B6, magnesium, zinc, all these will be deficit, right? ये deficit होते हैं और हम बच्चों में भी देखते हैं कि there is common deficiency B3, B1, B12, folic acid, magnesium, zinc and vitamin D. अब इनको जैसे ही ये नॉन वेज डाइट पे इनको जैसे शिफ्ट करते हैं तो रिच सोर्स ऑफ मैग्नीशियम एंड जिंक, एंड जो लोग इस पे बिलीव करते हैं कि इट्स पॉसिबल थ्रू द एनिमल प्लांट एज वेल, right? But only I'm going only by the plant based diet or by the minerals like magnesium and zinc. You know, अब जितने भी एग्रीकल्चर रिलेटेड जो हमारे साथ जो लोग बैठे हुए हैं, इफ दे उनसे अगर आप पूछेंगे तो मैग्नीशियम एंड जिंक वो हमारे प्लांट्स के अंदर भी डेफिसिट हो चुका है, राइट? एंड हम उनको फर्टिलाइज करते हैं बाय मैग्नीशियम, जिंक, मैग्नीज, ये सभी कंपोनेंट्स हम उनको दे रहे हैं. अगर हमारे प्लांट्स में नहीं है तो हमारे एनिमल्स में भी वो हमारे अंदर, हमारे फ्रूट्स में भी नहीं आएगा, हमारे वेजिटेबल्स में भी नहीं आएगा, तो हमारे अंदर भी कहाँ से आएगा? हमारी सॉइल के अंदर जो डेफिसिट हो चुका है. It's very simple quotations that if you want to check any village health, then you just check the soil from the village, right? And you can easily assess the village total health, average health, that how people are suffering with autoimmune disorders and all these things. And same thing is जैसे इन बच्चों के अंदर आप देखते हैं कि हमने देखा कि माइटोकॉन्ड्रियल डिसफंक्शन इज वेरी कॉमन, right? Q10, that's why Q10 deficiencies.
What about carnitine and essential fatty acids?
Every child is deficit with that,
Mhm.
right? Even taurines, cystothiones, N-acetylcholine, all these were deficit for about each, right? Yet, even glutathione, you can check in every person, every child, right? There is glutathione level will be just 0.
Yeah, antioxidants, all the antioxidants.
Totally, because cystothionein is deficit,
Yeah,
and the reason behind that's methylation defect,
definitely.
right? Because cystothionein is not due to methylation defect, it's not converted into the cysteines and again downstream to the glutathiones. So all these things are main. It's totally with the metabolic health. And why are we thinking that it happened by the GAPS diet, by the fat diet, by the low carbs and high fat diets? Because if we use the high fat diet, then we can use the ketone as a bypass source.
Yes.
Right? To support the mitochondrial dysfunction. Right? So that's why they are getting better after these things. सो उन बच्चों के अंदर अभी हम जैसे हमने उन बच्चों के अंदर दोबारा से Q10 मल्टीविटामिन्स, मल्टीमिनरल्स, आयोडीन्स, manganese, saline, vitamin C, and I also mentioned that vitamin C, every person is deficit with the vitamin C. It's a if you go through the organic acid test, and you will find that every child have a very severe deficiency of the vitamin C and glutathione. Means all our antioxidants level on that is.
Yeah.
That's why we are under the oxidative stress, and we can't fight with a plant-based diet.
Yeah, definitely. Because, when we put the people on the meat-based diet, like if they have another inflammatory conditions, because I believe that inflammation plays a major role here in autism, na?
Yeah.
And when we remove all the plant-based diet, we see like the inflammatory markers, they come back to the normal range.
Yeah, definitely. It's an involved part in the autism when we're treating the autism, that we are not addressing the inflammatory markers, right? And if inflammatory is very easy to assess that by the checking the histamine and all these things. And if you can assess all the inflammatory markers, then if you can reduce that markers, then it can be possible, right? And by supporting the non-based diet, by supporting your microbiomes, that's very important as well. If you are just giving the supplements, of course, vitamin C, all these things, but still child will not get better if you are not focusing on the microbiomes and your gut health. And specifically, you have to put child on the high fat, low carbs diet, not low, even I will say that totally remove all the starches and carbs as well. जो बच्चे totally carbs and starch को remove कर जाते हैं, right? वो कुछ बच्चे तो ऐसे हैं जिसमें कि within 3 months भी workout हो जाए, but we don't advertise to them in our center because ethically it should not be advertised, right? Because miracle should not be advertised.
Yes.
But generally I say okay, averagely it takes 1 year because सभी बच्चों, every child has different conditions and different deficiencies and different biomarkers. So जो इस essential fatty acids के अंदर भी deficiencies के अंदर आप देखते हैं कि DHA, EPA, they are also deficit. Fatty acid oxidation defect उनके अंदर भी हो due to metabolic disorder. उनके अंदर जो DHA आना, EPA levels, EV deficit हो, उनके अंदर वो रहता है. एंड जैसे पहले इस चीज को कोई रिकॉग्नाइज नहीं कर रहा था, आपने देखा होगा कोरोना के अंदर इस चीज पे फोकस किया गया लास्ट, राइट? यू नीड जिंक, यू नीड विटामिन डी, यू नीड मैग्नीशियम, यू नीड विटामिन सी to support the immunity, right? And which is a major fact that we should discuss, especially in India, that if you go to the every pediatricians, that किसी private pediatrician के पास जाते हैं, बच्चे को बुखार हुआ है, they'll put on directly on the antibiotics.
Yes.
Right? Not single antibiotics. There's sometimes 2 to 3 antibiotics in combined. आम लोग तो वो उनके लिए तो सिंपल है कि एक सिंगल एंटीडोज दिया, इट्स ओके. बट जब हम डॉक्टर याद के साथ, he was pediatrician, he's no more now, and still we are missing to him. But he was saying that single dose of antibiotics can damage your gut flora, and it can be a cause of autism. Even the single dose of antibiotics.
So, but Dr. Pritpal, does the early diagnosis and the interventions here that you mentioned help children with the autism reach back to their full potential, and further you can integrate them into the mainstream education and social settings? Is it possible?
Yeah, it's possible. Even which thing you are saying, it was a traditional things that early diagnosis should be done, is very helpful for the autism. But it's we can say it's a golden period, silver period. But with the biomedical intervention, with the functional interventions, हर एज के अंदर बच्चे को फायदा.
Because that's a very crucial age of the neurodevelopment.
Yeah, up to 3 is a golden. 5 to 7, 8, we say it's silver.
Okay. So you
right?
have certain cases like, the people, they get back to the normal life.
Of hundreds of
Okay.
right? Actually, due to some privacy reasons, we can't put it to them on the
Yeah,
testimonials,
definitely.
and we should not, right? If we are charging from them, we should not advertise and put on them on our testimonials because it supports us. But over the hundreds of children who got better, and even so many kids who are going to school in CBSE syllabus and ICSE syllabus after. And very interesting thing, Jasmine, we are very confused because right now we are working under the under one roof. We are working under the holistic approach in which OT, SP, special AVA, all professionals are working under one roof. We are 11 professionals, but we are confused that which protocol is helping them, right? But fortunately, recently, हमारे पास कुछ जो वीडियोस एक वायरल हुआ, उसके थ्रू हम 10 बच्चे हमारे पास आउट ऑफ इंडिया थे, like Ireland, UK, and Bulgaria, from all these countries.
For some people, they are claiming that just the speech therapist can help these people.
No. I just और हमने जब देखा कि और वो बच्चे उधर जब गए हुए थे कि उनके पास वेटिंग लिस्ट बहुत लंबी थी, इंडिया आ नहीं सकते थे, थेरेपीज मिल नहीं रही थी, so no window was there. Then I offered them dietary protocols, and out of 4, 2 are fully workable.
No, great.
Right, and which given us strength to our thought that diet
Plays a major role.
important role. It's a key role. It plays a key role, right? So if generally James admits, he says that 55% in every autistic child, 55% the diet plays role up to 55%.
Yes, because
45 is the rest of all these things. And primary is the dietary. If someone says that मेरा बच्चा अगर मैं उसको secondary school में directly डाल देता हूँ, तो 12 साल तक वो ठीक हो जाएगा, 12 साल तक वो पढ़ता रहेगा तो सीधे 12वीं फर्स्ट आ जाएगा. It's not possible. He has to go through the primaries. And same, अगर कोई बच्चा सिर्फ special education, speech and ABA पे रह रहेगा, he might be trained just like a pet, but he can't be recovered. He can't be cured. Right? If you want to cure, then you need to address his biochemistry markers, his metabolic markers, microbiome markers. All these things you have to combine. Then you can make the strategy, and then you can make total protocol. Then it's helpful. Otherwise, it's not helpful.
Yes, see, autism and metabolism, they are related because the first study which came in 1985, where the researchers found that the 4 autistic people, they found lactic acidosis, which is a clear sign of mitochondrial disease. It was the first study in 1985. So there is definitely a relation between the mitochondrial health, metabolism, and autism.
Yeah, after starting the Q10, recently now they have introduced the PQQ. It's a pure form of the CoQ10s, right? After introducing PQQ and DMJ, right, you will see the changes within days. Right? Child who was very high. I have a child who was very hyper. He was from Australia, and mother came to me, and she was just sitting and just crying every time because he was not sitting, he was not paying attention, he was not listening, and he was totally lost. Even he was not aware of the parents, right? And after starting the DMG and PQQ, within a month, we saw the changes. And now he's a totally out of autism, right? And he has started to speak, but early signs of all autistic signs is formed.
Yeah, when we talk about the neurodegenerative diseases and that like Alzheimer and other things, and this is the condition which is neurodegenerative disorder. And in Alzheimer, we have seen like scientists are working a lot like how the ketosis, switching a person's metabolism from the glucose to ketosis, it helps. And like you mentioned, like when you switch a people to very low carb and a high fat, so you see the drastic changes within few months. So definitely there
Yeah,
is
even the when we are giving the diet, then people think that it's okay. We can give the millets. Millets are safe. Even we have recommended. Dr. Amar Singh, he was the key player in Punjab who use all the millets, right?
Yeah.
But in recent studies, we found that after removing all the grains, everything, and when we put child totally on the animal diet, then every child has recovered, right? And उसके अंदर भी आप हर क्लिनिक में जाते हैं कि there is a cultural restrictions एंड कुछ ऐसे लोग हैं जो रिलीजियस हैं, स्पिरिचुअल हैं, उनके बच्चे अगर ऐसे होते हैं तो उनके लिए हमारे साथ बहुत डिफिकल्टीज हैं। लेकिन अगर उनसे भी आप इंट्रोड्यूस करेंगे तो वो बोलेंगे यस वी नो। उनके बच्चों में रिजल्ट इसलिए ज्यादा है क्योंकि वो नॉन वेज टाइप, और हम दे नहीं सकते, इसलिए हमारे हमारे बच्चों में रिजल्ट नहीं है। वी नो, वी हमें पता है, लेकिन हम उस वे में कुछ देख रहे हैं। देन वी इंट्रोड्यूस देम some totally milk based product, dairy based products, because in autism before camel milk there was no way, right, for vegetarian people,
Okay.
right, कि आप कुछ भी उनको दे नहीं सकते animal food। लेकिन after the camel milk study we conducted in 2010 and finished in 2013 with the help of Dr. Yagil from Israel, it was published in IMG, and उसके अंदर हमने ये देखा कि हर एक ऑटिस्टिक बच्चे में उसमें रिजल्ट उसमें आया, right? Because we use the camel milk and we use the different products of camel milk like fermented milks, whey proteins, everything from the camel milk, right? And that was the only alternate for the vegetarian people. We are also struggling. Still, we are struggling, but we are not getting results as the getting who are totally on the non-vegetarian diet.
Okay. So what other than the camel milk or the dairy products they have?
Dairy products they can't use the we don't recommend the cheese, right? And we only recommend the fermented milk, means fermented dairy products, ghee, butter, let's see, curds.
Everything from the camel milk.
Everything is from the camel. You know, just mean that अगर हम बाकी चीजों को छोड़ भी दें, right? बॉइन मिल्क जहाँ काउ मिल्क, बफलो मिल्क, इसके जहाँ गॉट मिल्क इसी पे रखते हैं, जो कैमल मिल्क की जो कैमल्स की जो डाइट है, राइट, दैट इज प्योरली ऑन हर्ब्स, जस्ट लाइक पुनर्वा in Ayurveda, in other words they say it's it, Bakhda, in Ayurveda we say is Gokuru, they take bubbles, shishams, all these things, all these are herbals, right? So they are going to, even the thor and everything, right, palms and everything, and so that because of this factor मेरे से अगर कोई पूछता तो क्या, मैं मतलब ठीक है, ये भी तो डिफरेंस है, क्या हम यूरिया एंड डीएपी बेस्ड प्रोडक्ट तो नहीं ले रहे हैं। इंडिया के अंदर रहना, नॉर्थ इंडिया में रहना और बच्चों को ट्रीट करना, इट्स वेरी डिफिकल्ट because everything is coming from the DAP. And you know, in 2009, when we conducted the study, we found that the uranium level was very high in every child.
Yeah,
right?
the toxicity, if you can talk
Yeah, we are the first who introduced the heavy metal toxicity.
Okay.
In human, in Punjab, we can say northern India. That was the largest study. That was the largest study in the world, which was very popular. And उसके अंदर जब पहले स्टार्टिंग के अंदर हमें पता नहीं लग रहा था कहाँ से, what are the sources of the uranium, what are the sources of lead, why they are increasing day by day.
So you have seen the uranium, arsenic, and lead, all these, the toxicity in the people of Punjab?
Yeah. It's very common. And even the cadmium, nickel, arsenic, aluminium, uranium, barium, platinum, all these are the heavy metals are available.
So any specific region of Punjab?
Reason in Punjab, not in Punjab, in all areas where all the green revolution happened. Overuse of the phosphate fertilizers, right? And there are some pesticides which had arsenic levels, and nickel is coming from utensils, right? Every shining, जितने भी आपके utensils हैं उसके अंदर आपको निकल मिलेगा, right? And aluminium, we are consuming, I think so, in grams daily bioutensils, right? हमने recent जब डाइट के ऊपर जो फोकस कर पा रहे थे, तो हमने देखा कि हमारी किसी भी जो मार्केट में गए तो हमें कोई भी ऐसा यूटेंसिल नहीं मिला जिसका बेस एल्युमिनियम के बिना हो, एल्युमिनियम फ्री हो, right?
Yes.
Everything was the aluminum. So now everything is now increasing. And
So what do
there
you
is
recommend? The castor oil, castor iron pans?
especially generally it's in New York now. Recent research they recommend only glass.
Glass. Okay.
Even they recommend the stainless steel as well, right? But
But it's difficult to get it in the pure form.
Pure form. Yeah,
Yeah.
base is the aluminium. Its base is the aluminium, right? And uranium is coming from DAP, phosphate fertilizers. And around now the recent findings that shows that high levels of nitrates, and nitrate it's totally responsible for metabolites, for metabolic disorders. So nitrate level should be less than 5. It's now in our research recent finding, it's 517 in groundwater. It should be less than 5. And same as the uranium, it should be less than 20. But now recent finding, we found that it's 1270 ppb, and it's increasing day by day. And some peoples now you heard that in Malot area and Abor areas, they are saying that we found the potash and potash phosphates and everything from the agriculture land, right? And हम जो हमारी assessment है ये ऐसा है कि it's not like that. We will not. It's general find. We have found all the metals and all ingredients which already we have dumped in our agriculture lands from 40 years, and still it's ongoing. And recent जो अभी जो सबसे बड़ा अटैक जो मिस ना हो जाए हमारा, वो है कि हमारे पेस्टिसाइड्स बायर जो मोंसेंटो था वो डायरेक्ट इंसेक्ट्स को या इनको किल करने के लिए आता था. अब बायर की जितनी पेस्टिसाइड्स हैं वो डायरेक्ट पेस्ट को नहीं मारेंगे आप. They're saying that we are attacking their reproductive health. वो उनकी reproductive health को डैमेज कर रहे हैं. And फ्लाई का जो फ्ली रहती है, हमारी जो पेस्ट रहता है, उसके जीन्स है ना, हमारे जीन्स, right, up to 66% genes are similar to that pest. अगर उसको डैमेज कर रहा है हमें भी करें. And today I was reading the WHO guidelines about the drinking water. They said that which we have decided the limits. Suppose they have decided the limit that it should not be more than 30 ppb per liter in groundwater. They said if any person consumes only 2 liters per day, then it's a 30. If he is consuming 4 liters, then it should be less than 15. If he is consuming 6 liters, 8 liters, then it should be less than 5.
Oh.
Right? So the safety markers, when we read the safety markers, then we should also correlate that how much we are consuming.
Definitely.
Right? But they have a set of markers and different.
So, Dr. Pritpal, before we conclude this session, I would like you to give one message that you would like to share with the parents to help prevent the conditions like autism in the future generations.
Yeah, definitely. It's better than the prevention is better than the treatments. एक तो जितने बच्चे हैं उनको कभी भी फॉर्मूला मिल्क पे मत डालिए. It's better is that कि आप उसको फ्रेश मिल्क कहीं ना कहीं से अवेल कराइए. It's very difficult in New York, but in India it's very very possible now. कम से कम एंटीबायोटिक्स का यूज कीजिए. ऐसे डॉक्टर्स को ऐसे पेडियाट्रिशियन को पकड़ने की कोशिश कीजिए जो थोड़ा सा लेट चलता है. एंड थर्ड वन इज दैट हमें कम से कम जो है कार्ब्स डाइट पे रहना चाहिए. मैक्सिमम फर्मेंटेड डेयरीज एंड फर्मेंटेड प्रोडक्ट्स के ऊपर जितने भी.
What about meat?
No panic.
No, what about meat?
Yeah, definitely. Meat is the ultimate source. And it's my personal experience with my child. He's 11-year-old and he's an cricket player. And पहले बहुत ज्यादा वीक था, वो चलता नहीं था, भागता नहीं था, बहुत वीक था. बट लास्ट 3 years से जब उनको टोटली शिफ्ट किया गया, नॉन वेज डाइट पे शिफ्ट किया गया, you will surprise to know 11-year-old child, he can run up to 8 kilometers.
Oh, great. So you completely eliminated all the grains and the processed food?
Yeah, totally.
So it's like on a carnivore diet?
Yeah, same. We can say we don't say it's a keto, we don't say it's a ketos, but we say it's a low carbs and high fat diets.
Okay.
Right. इस पे आप बच्चे को रखिए और आप secondly before going to plan the child, we must go for some genetic mutation profiles. Go for the testing genetic part.
Okay.
And from that you can easily find that MTHF, whatever the MTHF health, whatever the VDR health, whatever the POMT health, what are all these genetics. There are 16 genetic mutations which are the responsible for the autism that can be easily tested in every country, right? And according to that we can decide. If genetic means doesn't mean के पहले जो हमारे बोलते कि genetic is a fixed thing. Now genetic is not such a fixed thing, right? We can bypass, right, by giving the supplements, by giving the diet, high diet. So it's possible to do that.
So thank you so much for sharing your insights, Dr. Pritpal, and we hope that your message reaches the people so that they begin to eat in a way that aligns with our human evolution. So I believe that meat is a central component of human life.
And Jasmine, it was my first Zoom conference, right? And I was I had a little anxiety, and
no, it went very well.
I hope that my message was clear.
No, it went very well. Thank you so much, Dr. Pritpal. So Shashi ji is here.
Yeah, so Dr. Pritpal, thank you very much. In fact, the conference went very well and you shared very, very valuable information.
Yeah.
And it was a good interaction with both of you. I think Jasmeet has also taken effort to interact with you and
she's
information.
She's brilliant.
And we look forward for further collaboration with you in coming times, because you have a very important concept running in. So we'll get back to you further on this. Thank you very much, Dr. Saab.
Thank you so much, Dr. Pritpal.
Is Anup here?
Anup
is not here. Fine. Okay. Thank you.